my time. Go ahead and call this meeting to order. Starts the Pledge of Allegiance.
I'll go ahead with roll call.
Thank you.
Committee Member Horton is absent. Committee Member Grunts. Committee Member Knowles.
Here.
Committee Member Jones. Committee Member Schumacher. Vice Chair Dalton is also absent, and Chair Ray.
Here.
And you have a set of minutes from the last meeting, so if you'd like some time to review, they're in your packet, or we need a motion, second, and a vote.
So I didn't get any in the email. I assume others got emailed. I didn't, but I downloaded them and I would move to approve the minutes. Aye. I don't know why the city's not able to email me, but
I don't know either because I've checked and you're on the list.
and all these guys.
Yeah, I don't know.
Yeah, I know something's off.
So as you know, we have some new council members this year. And so Councilor Ken Bronson is your new committee liaison from the city council. So we just wanted to give you a little time to introduce yourself and ask any questions about the committee before we get started on committee business.
Good afternoon. I'm Ken Bronson, new council member. What do you need to know? I got 70 years to tell you about, so we go right to what's important. I don't know what that is, so I'll serve on this committee. I guess I was appointed due largely with my involvement with our homeless challenge and our resource center down there. And I've been involved with that with Larry Horton and Jim, myself. We built a lot of the things down there. And so I guess that's where it all started here. So as far as health, I don't know that much about your committee, what you do. I know a little bit about what Larry has told me. And I've read through your minutes, and but I guess I'll just stumble through it, and we'll go from there. So, any questions of you for me? Guess I'm off the hook for a while. Thank you.
For now.
Well, I might ask you, do you need information from us? I mean, you and I know each other and you know everybody.
I know Shirley. We're both on the Senior Center Board of Directors. I know Cicely, who's, well, we spent a lot of time together since in the last 2 months with a lot of others. And I know you, Dick. But other than that, no, I don't know any of you. So
Why don't each of you introduce yourselves, what you
yourself.
do, and why you were interested in serving on the committee?
I think that's a great idea. So
My name is Wanda Jones, and I'm the operations manager at Samaritan Health here in Sweet Home.
okay.
And I've been a lifelong Sweet Home resident. And with my background I've worked at the Sweet Home Clinic for almost 40 years. So before it was Samaritan, I was at the clinic at that time. And so was just interested in becoming more involved.
40 years.
Yes.
Okay, that's a good long time.
Yes. At the community level.
And like, you know me, but people over there may not know who I am. Shirley Schumacher. Sorry, I'm Shirley Schumacher. I'm a retired nurse practitioner. and moved to Sweet Home area about 10 years ago. And I've always been interested in healthcare and healthcare in the community. I did home-based primary care through the VA when I worked for them. So this has been an interest of mine also, and decided to see if I could serve on the committee. And I also volunteer at SHEM, and I'm on the board of directors at the senior center.
I'm Kelsey Ray. I've worked for Benton County Health Services at our community health center in Sweet Home for 7 years. I connect patients to a lot of different community resources, and so that's what brought me into the committee 5 or 6 years ago when we were still an ad hoc committee, attending meetings when I could, and then yeah, that's what I do.
And I'm Dick Knowles, met long ago. Been in the community for over 20 years, started with an interest in, I came to the community with an interest in mental health. My focus generally has been with the county, so I'm part of the Mental Health Advisory Board, Lynn Local Advisory Committee, regional group. So healthcare is an overlay of pretty much everything I do, with the subtle difference is my focus started with the county, realizing that the county and the city were not working very well together. So I spent a lot of time trying to develop that relationship. Again, more focused on mental health, but that lasted about 3 years, and somebody wanted me to generalize to healthcare. So, and I've been involved with the community health fair since the beginning of this group, actually, 2016. I have a note with, yes, with the Mrs. Gorley's description of why we ended up being here, which was Samaritan got themselves in a little trouble, and the city's answer to that was maybe we should do a health committee. And to my knowledge, we are it in certainly this region, and I would say probably the entire state. It is a very unique group. And I come from a background in California, and I can tell you I never ran into one. There were subtle community groups such as this, but none with the broad healthcare of the community. It's amazing.
My name's Mike Grenz. I'm currently the executive director of Sunshine Industries. I've worked with people with developmental disabilities since about 1978, and from direct care to case management to administration. And I just, have a passion for helping people with disabilities, and someone suggested that I check out if there's something I could do to help the healthcare committee. And I said, well, yeah, I'll check it out. And here I am.
Well, now that I know a little bit more about each of you, I should share a little bit more about who I am, where I came from. I'm a farm kid, 5th generation Oregonian. My relatives came across the plains in 1851 and 1852. So raised out west of Junction City, raised my family out Pleasant Hill way. Moved here 15 years ago when I took a job up here. Most of my career was in wood products or in wood products companies. I'm a graduate out of Southern Oregon, now university. But in 2008, when everything crashed and I had to reinvent myself and update my degree, and I ended up here in 2010, was hired at the senior center, but 99% of the job there was running the transportation programs. So grew that to what it is today with the Lynn County systems and the Sweet Home systems. So I've been retired now for about 2.5 years. So I also serve on the Lynn County Parks Advisory Board. I'm the chair. I serve on the Lynn County Transit Advisory Committee. I chair that. I guess I kind of I don't look for trouble. It just kind of develops that way. So now I'm on the council. So that's who I am in a nutshell. So
Welcome.
thank you. I think it's going to be a good group. I'm looking forward to being a piece of it. So
Alrighty, so I'd like to recognize our visitors and open it up for public comment.
I just came in case you had any questions about FAC stuff. We're just, here.
Okay.
I will tell you that when I was the one that started this committee, and a little background, we did have an issue with Samaritan. And we were in a city council meeting, and I said, I'm gonna start a committee. And I looked out and I saw Marty, and the CEO was there, and I said, I'd like to have both of you on my committee, and they accepted to be there. And it's the first time that's anywhere in Oregon or anywhere that I can hear of. And we started inviting people, and this is what it's morphed into. And I think that the opportunity that we have is very big, and the downside is very small. So we can do some great things.
Thank you. Moving on to old business committee goals.
So I know Dr. Horton had sent this potential list of goals out, so I printed that out for everyone in case you wanted to use that for your discussion today. And I know there was some talk of possibly recommending goals to City Council for consideration when they get into their goal setting session. This is a good time to do that because we do plan to meet with them next month for that. So if that is something the committee wants to do, I would recommend narrowing down what you're going to recommend to council, because they will also have a narrow set that they are going to approve.
So if I could, and I'm not trying to be argumentative, but that seems to be reverse. It feels like we need to hear what the council needs as their goals. If you go back into previous council goals, the city councilors would include something about community health up until last year when we suddenly got dropped. So I would encourage our council friend to at least include some language about the committee's health goals.
So the last 2 years, goal setting was done differently from many years
I appreciate
prior.
that.
And so this year we are trying to go back a little bit to how it was before. So the vision statement that the council adopts and has adopted for several years now includes 5 tenets, including, and I believe the one that the health committee, their goals fell under was, we aspire to provide viable and sustainable essential services.
That was previous to the last one.
So I will tell you, going into goal setting this year, we are going to redirect council to go back to those 5 vision statements. So again, if you have goals that you feel fall under that one or any of the 5, I would recommend that you forward those to City Council for consideration for their goal setting.
Or if I might maybe forward it to you and we could polishing them on them. I mean either way.
That's why I did going forward, because there was no more identified goals, which you need them. And so that's what happened, I think. Didn't go on with it like you.
And so now that I think you're revisiting your goals, it's a good time to send those back
And-
council's way.
And just responding to that over lemonade or whatever, at the time we were an ad hoc group, and the argument from us was a lot weaker than we are now a part of the city, which was my sense of the city acknowledging we now have a formal committee These are our goals as a city, and then we need to work from them. We should never have less than, we could have more. That was going to be, like I say, I wasn't being argumentative, but I don't think we want to go in with fewer. If we've got a huge list, which we don't, and I'm big on, not 20, let's get it 3 or 4. And I think everyone tends to think that way these days.
Well, I'm just, because the list from Dr. Horton was 10, that was why I was suggesting if you do have things you want to recommend to city council, you pare down.
Internally, we've already
Great.
thought of that.
Okay.
But
Again, this was the last list that I had, so. So I would love to hear how that was paired.
Question here. So are these the tender goals we're speaking of tentatively put forth in front of the council? Or we to carry forward?
So
to
again,
council?
this was just a list that one committee member forwarded to the whole
yeah,
committee.
we've never discussed it.
Yeah, so this is the first time that these 10 are being considered in a public forum. It was just a distributed list and there hasn't been discussion yet. So no, what I'm recommending is 10 is too many to forward to city council. That I would recommend you can adopt all 10 as a committee, but I would recommend you identify your priorities to refer to city council if they want to include them in the broader council priorities as well.
So this is a starting point.
Correct.
Okay, thank you.
I will say that I believe that we should pare down. 10 is a lot, and I love being chair, but it's really hard being full-time working and the list was a lot, and then my presentation that I've been working on. And so just for my sanity and my children's sake, I would like to pare down and limit some of the extra stuff that I don't think it's anyone putting pressure, but I naturally have a responsibility to feel like I need to take charge on a lot of things. But I think the more we focus on the things that we can change on this list, of course, continuing to support and promote the annual health fair, I would like to see even more promotion than what's been provided in the past. I think attendance to that is great, but it could definitely be better. And I just don't think a lot of people in Sweet Home know about it. So I have that on my list as well. But some of the other things, I guess my concern is, how do we as a committee support these things? Like how do we tell Samaritan to bring more services in than what they're already providing? So that's where I'm at.
And I will say, I know that when it was an ad hoc, clearly there was a lot of success bringing those services in. That predates me, unfortunately. So maybe some of the folks that were involved in those efforts can speak to that a little bit more. I apologize that I cannot speak to how those efforts were successful and how the committee interfaced with those.
I have to apologize because you and I have not met, Wanda. I heard a lot about you. But I've been working with the Samaritan folks for a long time and have a friend who's part of their educational hub. And one of the things that has occurred to me is we need to probably tie into the clinic and trying to figure out a way to use their space more than anything else. And maybe because this group has talked about before, maybe have some kind of community outreach system where we can provide in-services, training, whatever. And the hub folks are more than willing to try to come up with ideas. They have webinars that they already present. And, I'm just kind of jabbering here. I'd like to start to begin to make contact with them and get them to be a kind of a routine input to the local Samaritan, either one, but it seems now that we have the clinic, we've done all that work. this would be a good time to tie it in. And everyone I know there, in Samaritan loves to have the community involvement because it makes them not only look good, it just helps.
Right. And I do think there's potential for community education and involvement. I just don't know. I mean, increase health services as a 5-year goal and pediatrics, geriatrics, endocrine, mental, and phlebotomy. So, I mean, if we're calling things out specifically, we have those things. We don't have pediatricians, but we have care for children. We don't have geriatricians other than at Wiley Creek, but we have care for elderly. As far as endocrine, that's a very specialized service. And we do have the ability to have telehealth appointments in our clinic so that people can connect to endocrinologists outside of our community. So there's potential for that. I would say mental health services and behavioral health services is a need for us right now, and we are actually recruiting. So, if that's, I would hesitate to call out specifics just for Samaritan, not because I don't want to go there, because I want to. I want to promote more services, and the more services we can bring, the happier I would be. And we're working on that.
When I read that, I was reading it as continue as opposed to increase.
Yeah.
It was kind of to the previous point from the audience that we didn't have a clinic before. We didn't have all of this stuff before, and now we do. And
Right.
I'm a big believer in patting ourselves in the back somewhere when we present to the council. But I totally agree. And part of the thing is you don't want to ignore the fact that the county does have these services, and
Right.
our chair here provides these kinds of services. So
Absolutely.
we don't want to focus on one particular group. We want to broaden this and make sure that we include everybody.
Then I would say one of the things that I feel is lacking is education of our citizens that live in our community to what services we have. We do have services, but they don't know about them, and I don't know how we can get that information to them. And I'm not just talking about Samaritan, I'm talking about the city. I'm talking about Gentle Dental that brings a dental van here once a week and sees patients, and not necessarily our patients. So
again, if I could interrupt, we actually had the medical van, which brought both mental health and medical services. It didn't last very long, and then the COVID thing just blew everything out of the water.
Right.
And I've slowly, in another group, I've slowly been tickling at Samaritan. Can we start to get this, maybe get the van back? Because it was coming once a week, going over to the Methodist church. I was there probably half a dozen times, and there were always people there. Mental health. They had a psychiatrist who was actually, he showed up once and we're just walking the streets. I mean, how many times does that happen? But
I tabled at it to offer Oregon Health Plan assistance and signups for people who didn't have insurance and were new to the area and saw a medical van. So it was a partnership with, I know it was mostly hosted by Samaritan, but it brought a lot of people to the table, and I agree. I think with COVID happening, it kind of went by the wayside. And it would be nice to have, mental health services.
they now have a mental health bus.
Yeah.
They have a van too, and it's actually in this community once in a while. We just have to find them and make sure that there's a connection to us.
I got one thing I'd like to say here. Yeah, I look at all this. I'm clear on the outside looking in, so first time on it. But I see, in my opinion anyway, one of the biggest things is just preventive. Keep your community moving. You know, for our older people, Silver Sneakers programs, for the youth, you know, like the reading program, just getting kids started, but keep people motivated throughout their whole life cycle to keep moving, so to help prevent. You know, I don't see anything really that focuses on that.
If I might, that's exactly what the hub does, Samaritan's Hub.
The what?
The Samaritan has an educational hub. It's a group, and they do walks, they do diet sorts of issues.
It's the regional health
Regional health,
education.
there
hub.
it is, health education.
Yeah, they do walk with ease programs as well as education for chronic conditions and how to like pain. They do a living well with pain course, and they're typically about 6 weeks courses depending on which one. And they'll come into communities, but they also have virtual options as well.
Right. We
You know,
have-
I think something like that, you're focusing
Right.
on the entire population at every level of life.
And that was kind of my
Yeah.
push to work with the local clinic.
Yeah,
Now that it's
yeah.
open. They've got some room and, you know, start a walk from there to City Hall and back. I mean,
Oh, yeah, there's so many
totally
things you
agree.
can do with that, but it becomes a community involved and you
Yep.
involve the,
Yep.
you know, the grade schools, the junior high, the high schools, and all the way through there. Yeah. Okay, you're already working on it, so good, good.
Some of, go ahead.
If I would ask that you please use the mic just so it's on the record, because we do have folks that use the recording.
I think.
You're
okay.
on.
So, I think what I'm hearing here is that we don't have enough recognition in the community of what's actually being done or what's going on. I don't know whether that's one of your goals, but that's a big goal for, that could be part of it. To have several goals is not a problem, but to highlight 2 or 3 is great to send on. But these other goals, you might, if you go through one and you've already taken it off your plate halfway through the year, that doesn't mean you can't look at another one and say, how does this fit into what we're doing? And that's all I was wanting to say. But I think the big thing is that you're both Samaritan, Benton County, mental health, all of everybody does not pat their back enough to let people know what they do in the community and let people know how they can become part of that.
And I'll say too, early on, back in the election, one of the pieces of feedback staff was receiving most frequently was that we should anticipate an overarching city council goal of enhanced communication citywide. And so I think it would be very appropriate if one of your goals was related to some kind of information campaign.
Yeah, that's what I was going to say, was that the problem is getting the word out there and getting the access. I mean, people may not want to go to the clinic, but like we mentioned, the church. People may want to go to a church if the church is willing to open their doors and they can advertise it in the church and have the community come there. And then, you know, just advertising, getting it out. I mean, I had a dietitian come twice to the senior center to give education. I had 2 people show up one time, 1 person show up the second time. And the word was out, posters were out, and went out in the senior bulletin. It's just getting it out there to so people are aware of what we're trying to do, and so that they will come, and having it in multiple places in the community. So, I mean, the senior center's available. I mean, and then local churches, like that letter that you wrote for the churches. I mean, if they would be willing to open their doors to some kind of education, Samaritan Clinic. I mean, have multiple access points and then advertise it out there. And because people just aren't coming because they don't know about it.
So any more thoughts on specific goals that you would like to focus on, either overall for the committee going into the next 5 years or certain things that you'd like to forward to council?
I do have a question about the whole 5-year thing. I don't remember us deciding that we needed to do 5-year goals. but the city does have 5-year goals.
Well, and so the council goals, they are typically limited to 1 calendar year. So I would encourage you to do something that is something that you can actually bite off and chew. Yes.
Yeah.
Right. And number 5 and number 10 are basically keyed into each other.
And
So-
there's a couple of others that are very close. Yeah.
So they can be combined and put together with things but yeah, I see 5 and 10 for sure.
When would we need to have our recommendation to before when?
Let me double check the calendar. Because I don't think you'll have another meeting before.
Because yeah,
Yeah,
it's
so
to be decided tonight.
So we're planning to do 2 city council goal setting sessions this year. But yes, your next meeting is the day after the final one.
That's what I thought. Thank you.
And so if it would work for the committee and this would be the preference, we could always have the first goal setting so you can hear what comes out of that. Move your meeting like a week earlier so you fall in the middle and have something to recommend for the second goal setting. But again, that's totally up to you.
Pause, please.
Yeah, let me make sure we have chambers
I
that
was gonna
day.
say, does it even work for you guys?
We're all going to Adam's house.
That would work.
Wednesday, the
here,
19th.
The 19th.
That would
Okay.
Just because I know sometimes when you see goals the first time, you want to marinate a little bit.
Yeah.
So.
I know when I spoke with Bob before today about possible goals, he asked to maybe just throw the suggestion out there to keep goals general. I mean, it is a hefty list, but if you look at it, a lot of these things do fall together. So we could have an overarching categorical goal that these things fall under. I can only speak for myself, but I'm not someone who wants to just, oh, my list is done, so I'm done. So I don't think that that would be limiting us at all and saying, oh, we've only got like 2 things we have to accomplish this year and then we can move on. I think we're all pretty passionate about health. People don't normally go into the health field if they're not passionate about health. And so I don't think that that would limit us or stunt what we could provide to the community by doing 3 more broader goals that encompass some of these things from Dr. Horton's list, and just some of the things that we already do, like some supporting and promoting the Sweet Home Health Fair, organizing a health forum. I know this says quarterly, but we've talked about that in the past, and maybe that wouldn't be ideal. Maybe just getting one off the ground for how long we've talked about it and organizing one and seeing if anyone even shows up, if it's even a topic that people want to talk about. And then also, one of the suggestions for something we could send to City Council to encourage them to adopt a health goal was something as simple as creating a healthier community through education and expanded resources. That's something I've heard a lot tonight is education. I think we've heard that for a long time. I know you guys have heard that when you were on the committee. So I'm all for more education for resources, for different types of care that different health agencies provide. Yes, there's Benton County and yes, there's Samaritan, but there's also Ridgeway. There's more health organizations here than there was when I first started coming to these committee meetings. And I don't think that's a bad thing. And I think the more that we spread that information, the more the community is aware of what is out there. They're more empowered to make the proper decisions because no one knows better about their own care and what they need than the patient. So
I will say for
But,
council goals, we do ask that they try to identify an actual deliverable.
Okay.
Just so that we can say, yes, this was accomplished. But I think it's a great idea if you adopt your broader goals that steer your ship. But then, for example, if you want to do something with education, you know, if you say organize one community health forum, that's great. Or design 2 annual newsletters with healthcare resources, that kind of thing. I think that would make sense.
I have a question about resources and the resource list. Is that something that the city will be putting on their website?
Yes,
Okay.
we had it on the list to discuss today, so I just wanted to make sure you were all good with it in its form before it gets published. But yes, we
Okay.
will absolutely put it out.
I'd like to include that into part of our goals of just, I mean, I think it should be our responsibility to help maintain that list. It was
And-
a lot to put together and I'm not putting that on anyone
Yeah,
at the city.
And I will say, when this group was codified, that is part of your charge.
Okay, perfect. And that quarterly, like how often would it need to be updated, maintained?
Definitely at least annually.
Okay.
I do feel like that I really like the creating a healthier community through education. And I feel like we could have a concrete goal of organizing community health forums, whatever that number is, 1 or 2 for the first year. And I feel like those two would go together well and be something that we could accomplish.
It wasn't on. I pushed the button, it didn't go all the way. One of the things, just to remind people, much of this list that you're looking at actually came from the work with the students at the school. And we don't want to lose them in this process, which again seeks to have a sentence, but broad enough to include all of the providers in the area. So if we have subcategories or whatever, they put a lot of work into this, and a lot of these are driven by the community. They didn't make them up. We all went to their meetings and provided this information. So we're already halfway there.
Yeah.
And you're referring to Western University,
Yeah.
correct?
Yes. I also had from Bob and I's discussion, foster growth and partnership amongst current and incoming Sweet Home Health partners. So I think that would also encompass,
Same.
without calling out individually each one, because we are represented in the community and on the committee as well. And I think they're all doing great work. And I'd like to see that grow and
Yeah,
continue.
I think the group, we as a group need to know all those people,
Yeah.
but the larger goal is all those people.
Well, and at some point, I know CSC will be in this building, and I also consider them a health partner. They do a lot of work to help patients and community members in Sweet Home. So that would be another fostering growth and partnership with them. Do we have an update on when they're coming?
So they did indicate today they are ready to sign the lease. So
Okay.
yay.
I also would like to get back to hosting different agencies here. I thought the presentations went great at the beginning of the year last year, and I think there was some absences and having to move meetings, and we kind of lost some of the steam on that. I would like to have them once they're here and ready for that.
Lynn County Mental Health actually reached out, and they are tentatively interested in presenting in May.
Oh, okay. Thank you.
I just have a question about one of these that I don't know. Continue Mike mentoring program at Sweet Home High School. Do we do that? Med school students. Okay, that was something that they were doing and that we were supporting them
I
somehow.
had the same question. I don't know if it's still going on.
Go for it.
It is going on. We had Di Lacy just came and talked to the Rotary yesterday. And I'm putting together a program for this summer that in lieu of us, been a free program for us here in Sweet Home because we're the poster child for what's going on with this, the working together and the community involvement, the schools, this. And so if we put together this program for them, then they're not going to charge us anymore. So we're trying to put together a program to help them further their leadership in Oregon. Well, it's a leadership program that would invite people that are interested in being doctors, rural doctors from all over the state of Oregon, into Sweet Home to do this program. And in the past, we've done it on the lake with kayaks. And we're going to do something similar to that with these kids that are interested to teach them some leadership skills and understanding teamwork and working together. And you have to come up here or else you're going to be in deep trouble.
Western University came and their med students that want to be rural doctors came and did a survey in conjunction with this group. And so they came back and they interviewed our community as to our needs. And then they went back and they worked on this together and they made this great big report and they have followed through with this. And as a result of that engagement with them, we have Western University engaging with our high school students and have an ongoing program so that our rural children can identify that they can go into the medical field and become doctors, and that these young med students aren't these amazing, wonderful things that are unattainable, that these are human beings that made the choices to go into rural medicine. And so it's an ongoing program. And so all of this evolved from this group and that survey. And so that when I did not elaborate on how impactful some of the goals that we have met have been. And so this will continue because this program of them coming into our high school and literally taking our children over to look at cadavers and stuff at their site and all the things that go on with that program.
Kids love it.
It's incredible. That we wanted this to continue, but we don't want it to cost our community any more than it should. And so by having this other partnership going on, for the med students around the state that want to be rural doctors to come to Sweet Home and be on the lake in our kayaks and be able to hear speakers and set up a program like that. That's really exciting to be able to be asked to do that. And so I just look forward to more wonderful things happening with this partnership.
So we went from one program,
I'm sorry, if I may, I think for the purpose of the committee, I think the question is whether this program, which is wonderful, is something that they want to incorporate in their goals or not. And
Okay, I need to finish this. They went from one class of 21 kids to two classes of 21 kids. So that should explain how it's projected in the community.
I have a question about, I think this is listed in our duties and powers and responsibility that I was reviewing before to look at some of our goals. It says to provide funding, volunteers, and or support for any improving community health resources directed by council vote.
Comes out of your pocket.
That's, yeah, I mean, that's.
We don't have any funding.
We don't.
Correct. You do not have any funding. So I think the intention behind that was just that if city council does adopt something by vote that is related to community health, at the very least, they would hope that you as committee members would advocate for that in the community. There is not a monetary commitment unless you wish to or can secure a grant or whatever. But no, you are not automatically required to pay for something.
I didn't think I had to pay for it. I just was trying to figure out. I know we have funds that are for the health fair. I just wasn't sure if there was nothing else I knew of that. Okay. Moving on.
So any more discussion on the goals, or do we want to wait until 3 weeks from now and revisit after council's had a chance to talk through some of their high level thoughts for next fiscal year?
I came in hoping to get the council feedback first, so I'd like to watch them work on that.
Okay.
Yeah.
All right, then we will replace it on the agenda for next time.
And then we'll move the meeting to the 19th.
As long as there's consensus amongst all of you to move to the 19th, that's fine for staff as well.
I think that's fine.
Okay.
Fine with me.
A point of clarification here. So what your suggestion is for feedback from the Sweet Home Council rather than taking something that you've kind of come up with for community health to the council.
So Councilor Brunson, I think in your role as liaison, since they've identified some of those higher level goals, it would be appropriate in the goal setting, if you agree with those, to bring those up, and maybe some discussion will ensue on some more targeted goals that then the committee can consider if they would also like to adopt and basically recommend back to the council as an endorsement.
That's what I would like to see. Now, this is my first rodeo with a group, let's just say like this particular group. I just have this gut feel that the more prepared and with a statement going in, the better job that I can do as a counselor to help direct things. 'Cause I really believe that we're going to have some communication challenges. So I'm just saying that the better prepared with the package that I have going in, I think the more successful we can be. Now, that's just my opinion on this.
If
I
I
know
might-
now it's a public record, but it is what it is. That's what I think is the,
So that's why
It's not
it's at the committee's discretion if they want to recommend something to go forward now that we bring up at goal setting, or again, we've had some high level items brought up that we can discuss in that initial work session. Once they hear how that conversation goes, they may have additional feedback going into the final goal setting session. But again, it's up to them if they want to make a formal recommendation today or not.
So if I might, Councilor Bronson, the way I'm thinking about it is to have the city council have their first work session, goal setting session. And, aim towards some sort of health committee language, working with, giving us money, something like that, just to see how that works. So you don't have to present what we're doing. It's more making sure that the council acknowledges, as they have every year before, that the health committee is an important committee to them. And then watching that interaction, not watching, but after that interaction, we can give them what you're asking for, something more specific. Go to the second meeting. These are the goals of the committee. And then that would go before them, not for approval, but that's, so we're just interjecting.
I see that. I would like to have something
The first
that
meeting.
would assist me in conveying this. It doesn't have to be something that's for the council, but just something concrete to work with. And it doesn't have to be, this is our final document, but it's just a little guidance of the big picture. Because I like what I see here, but as a group, we've already tore it apart and put these back together. And so I'm not sure what it is now, but just something just to help give me a little guidance to help carry that all important message of the importance of your community health and just something to stand on going in.
Well, so I think Councilor Bronson, the high level things that they've identified are things like education, additional resources, increasing local partnerships. So those are kind of the broader themes that we're hoping to tease out in that first goal setting session. And then I think we can see what council has consensus on, and then community health committee will be better empowered to look at their specific deliverables and how that fits into how the consensus went in the first goal setting session.
The minutes of this meeting will help me.
That's
all I ask for.
Not a problem.
I don't need any more of that. I can work from there because that would be that will give me the structure that I can pick from to really help carry the message. So we got it. Thank you.
So I think that concludes the goals discussion, Chair.
Yes.
Okay. Then I think the next several items are yours.
So next I have the notice to area churches. So on the third page in the packet is the letter that I wrote up and sent to both Mayor Coleman and Cecily to have reviewed to just make sure those words are okay to say, because I don't always know what we're allowed to say or not to say from this position. And then it was sent out to all of the Sweet Home area congregations, churches, pastors. I have received one response so far. I received it like right after the letter got sent out, and so I was really excited. But then I haven't received any responses since. So is that something that we should follow up on at some point if we don't receive any further responses? Would that look like an additional letter or?
Yeah, I think an additional letter would work, or if some of the churches do have an online presence, sometimes that is better.
Okay. So I was going to present and just discuss some of the feedback I had received. Again, I only received one response. Let me pull it up real quick. They received our letter. It's sent out to the group of churches in Sweet Home. And this is from Hillside Fellowship. They don't currently house people in need at times of extreme cold or heat, but they do have 4 restrooms and 2 kitchens and lots of space with heat in a basement that stays cool in the summer. So it's possible that they could open up for temporary help in times of need. So it's someone that wants to partner with us if that's what we're looking to gain from the letter. I provided my phone number and my email, so I'll keep filtering the responses and adding them to a folder as I get them. And I think if we don't get any responses, I will probably just plan to follow up to get the letter sent out. I would like to see it go out again by May, because I think right now we're thinking a lot of like cold weather issues, but we know that there's been power shut off during heat, and that's sometimes an issue for people as well. So I'd like it to go out in another cycle before summer and cooling shelters are needed. So that's where we're at with that. Is there any questions about the letter that went out? Okay.
Well done.
Thank you. And then the community needs list. So that is pages 4, 5, 6, 7, front to back. Thank you. It's the labor of love. I've poured my heart and soul into this list.
Sure did.
And I just kept changing it and cutting it up in pieces and pasting it back together again. I think that accompanies a lot of things that I think of when I think of health and like the social determinants of health, that big ol' umbrella. If there's any resources that are missing that you guys have looked over and seen, I tried to add also, there was a great suggestion to add our community partners from the health fair, and I'm sad that I didn't think of it before doing so, because I think it is important to call them out. They do come together every year. We have a lot of return vendors that really like showing up to tell the community about all the services they have to offer. So I think it's really important they're included on this list. I tried to keep it to mostly Sweet Home, and that's why there was the additional resources at the bottom that call out. Lebanon and Halsey are listed, and I know it seems odd to have Halsey on there and nowhere else, but these were the only cities that had their own resources list on their city websites. So that's why they got specific shout outs. And then listing the Lynn County area resources and the Oregon Health Authority's resource finder. So that if there's anything on there that someone else would like to look at. I tried to be intentional in the list. But again, if there's anything that's missing, I think this is probably going to be the last round of, hey, add to this and let's go over it and make sure that the information is correct and up to date, because I really want to get on Debbie's website as soon as possible. Because yeah, it's and I think that was, we had never really confirmed it was a goal because we were fresh baby codified committee, codified. Anyways, and so we never really established goals last year when we first got started because we really didn't know a lot of the rules and ins and outs. But I think that was one thing that continued to be, we need to get this list, we need to have this done, and we need to give this to Cecily so it can go on the city's website. So I'm glad to say I think it's almost done.
And if I might, for people who weren't here before, we had come up with a resource list before in, well, working with the police department. And they came up with basically what was it? I think it was just front to back flyer they kept in their cars, so that if the policeman was face off with somebody at 2 a.m, he could reach into his car and say, go see Adam at his house. He can help you. I mean, it worked quite well. I'm sure most of that stuff is now out of date. This is much more extensive, and it might be something we can again work with the police department to come up with a little smaller. And I have thought similarly, I would like to see churches and things like that have this resource list, but maybe as a group we can whittle it down much as we've done with the goals, so that we can specify for them, because that's a lot for just a secretary at a small church gathering to know what to do.
I don't know where we would put that information, but I would like to say that I do have it in a Word document because I love Word documents, and everywhere does PDFs, and those are really hard to edit. So if there's anyone in the community that does work with patients and clients, it's something that I've started using and sending to people who help cover when I'm out of the office, so that they can hack it up as they need it and pull certain resources off of it to paste into whatever communications we're sending out to patients. So if anyone in the community needs to do it, it's in a Word document. So it's super easy to do that and whittle down and piece together just what you're wanting specifically, but still have the original form. So if you need to reference that at any time, you can, as well as go to the city. But yeah, that is something that I was thinking about. Because yeah, it's a very extensive list, and I think it will be helpful, but it's also like 6 pages. So I know that not everyone is going to want to print that out and have it. But part of the reason we want to get it on the city's website is things change. We know this, not only during like public health emergencies like COVID was there ever changing times, but businesses move. And there's been a lot of great resource lists that I know CSC has put out, but those can go out of date very quickly. Yeah. And I know when I had sent this out for review, there was things that had changed in a building where I sit in and have space every day that it just hadn't been updated in the 2 months since I had last looked at the list. So I am not lost on the fact that information is always changing. So I think it'll be good. I would like to have it updated quarterly. So I will put that on my plate for something to do. So that way, I mean, if that works, I mean,
I will say, once it's up, it is super easy for us to change it out, update
Okay.
it, not a problem.
so yeah, that's the community resource list.
Pretty heroic.
Any questions?
I think the list is amazing,
Thank you.
and I don't think it's too lengthy.
No, I don't
Many of
either.
our resource lists are much longer than this, and I love that it's that they're resources that are easily accessible to local people.
And local, yeah.
I had done an initial version of this at the senior center, and front desk handed out a lot. You know, I'm new to town, I don't know this, and they don't go to the city, they don't go to the, what is that place on the main street? Anyway, they don't go there, the Chamber of Commerce, they come to the senior center. So, yeah, we hand out a lot of these too, so, yeah, it'll be used. And you can always circle the one that's important and give me the whole thing.
There you go. There you go.
Yeah, I know that when we first started talking about the list, there was talk of, well, there's other resources that people in Sweet Home can access or could qualify for. But I really wanted to keep it as close as I could to Sweet Home because I mean, we work with a lot of low income families. We work with a lot of unhoused people. They don't have transportation easily. And it was really important to me for people to actually be able to access the services that we are providing and saying, oh, here's this great resource. Good luck getting there. So that's where there was a lot of intention with the list, but I hope that we can get it up on the website as soon as possible. And yep, that's all I have for the list. Cool. Okay, so annual report update. I have a question. Will I just speak or do I need a PowerPoint? Because I've started preparing a PowerPoint.
That is totally up to you, whatever you're most comfortable with.
Will council have time for a PowerPoint?
How many slides?
I don't know. I'll need to look at it again. I just
Remember, we started with 10 goals.
I know.
It wasn't her idea, though.
How much time would she have?
Yeah.
yeah.
I mean, that's up to you. So, the good news is you'll be towards the front of the agenda, so you won't have to sit through a bunch of items. I do think typically when we have visitors, we like it to be 15 minutes or less,
Okay.
just so that if there are questions, there's time for questions before we get into the business agenda, and we're not here till 10 p.m.
I'd be glad to help with that. Probably we all would.
If I have part of a PowerPoint ready-ish, I'm just thinking we won't meet. Oh, actually, no, never mind because we've changed it. So now we do meet again before. Okay. Forget that. We wouldn't have met again before I present to council. And so I really want feedback to know I'm including everything that the committee wants me to let council know is our update for the year. But we do actually, so we will meet before. So I will shorten it and then I will bring it to our meeting on the 19th to review and add any changes because then I will meet with council the following Tuesday. Okay. And if anyone else wants to come, you don't have to.
Chair Ray, I just asked that if you're going to bring a presentation, don't have it just on your computer. We don't have any ability to plug in on the computer. So
Oh.
email that to either
Send it to me.
Stephanie
Okay.
or
yeah.
myself.
Any questions? That was my only question about the annual report and update is, I know that I intend to talk about the Sweet Home Health Fair because I think that's very important. The presentations that we started off with at the beginning of the year, the resource list. We had one more thing on our list that we were updating council on.
Well, you have 3 weeks to.
Okay.
It did occur to me, maybe just a very, very short blurb of where we've come from. Because there's, as Councilor Bronson said, there's a whole bunch of people that never even heard of us. And we have a substantial history with this city. Obviously, the health fair remark, but we have done things before. And
Yeah.
as Mrs. Gorley says, we probably ought to let them know.
Well, and that was part of my intention of asking how much time I have and if I can have slides. Because I also would like to, if anyone wants to send me information on past achievements, I would like to include that in the slides. I know we wouldn't have a Sharps container if it wasn't for this committee, because that was something I had fought for a long time and then brought it to you lovely folks. And finally it happened. And we had great success with our Sharps container. Lots of people in the community has utilized it. I know the school nurse for Sweet Home has had to utilize it. They didn't have a place to safely dispose of Sharps. So I think it's super important to include stuff like that. I do want to let council know where we've come from and also where we are now. So yes, I do intend to
Bit
do
of
that.
bragging.
Yeah.
We have to.
But yeah, I just want to know how much time I was allowed to talk for. I'll talk a lot if you don't shut me off. So
No.
God help me, I get nervous. Okay. That is all I have about the annual report update. Is there anything else from anyone else or anyone else who feels like they would like to present to council? The update? No, that's okay. I'll do it. Okay. That's all I have. Does any committee business for the good of the order?
Any questions from?
Yeah.
Not at the moment.
I have one quick. Cecily, we set up a time for open house at these. That will be coming soon. I didn't think we had, but that will be coming soon, and I'd like all of you to be in there when we do that, because there's been a lot of changes on that site.
Open house for what?
And the new domiciles that are there are very, very nice. Working on getting all the shower trailers and all that stuff in there, and the generators, and that should all be done within a week. So things have changed a lot down there. They're paving the road going to the water station today. So the next time you drive down in that area, there'll be a lot of new stuff. So I think that's coming up, and I hope that everybody can.
Oh my gosh.
I hope everybody can attend whenever that.
When is it?
It hasn't been decided yet, but
Got it.
it will be soon.
Okay.
I don't remember what I was gonna say. Oh, yes. If there is things like that are happening, is there a way for us to be notified about any health related things?
So yes, so if I get event information, I can definitely send that out to the committee. And likewise, if there are things going on in the community, health related, that you would think the city would be interested in advertising, please send those to us, because depending on the nature of the event, we do share partner events, for example, on Facebook, which is, our highest engagement. So just send them my way. We don't approve everything, just depending, but it's certainly worth a shot. So anything that, like, for example, committee member Schumacher with the dietitian, that's something we'd be happy to put on Facebook.
Okay, cool.
There is one other quick thing. The school district used to be part of this group.
Yeah.
And they're not showing up now. And I think that should be another reach out, maybe to start getting them to come back, because we are still at 12% of our kids are on IEPs in the district, and 11% of the kids here are homeless. And we still have high numbers of children that are on the, their food is what they get at the schools. And so they have been involved in this group in the past. And so,
I will say, while we don't have someone from the school on the committee, we have had Christy Walker,
Yeah,
who's heavily involved in school. She's come to quite a few of our meetings, as she can. And so I know she tries to keep a close tie. But I'll see if there's someone I can reach out to invite them to come if they'd like. Okay. Any more committee business for the good of the order?
We have an official list of members that's available. Is it somewhere?
What exactly are you looking for?
Just a list of members, names.
I will have to check if your roster is on the website. If not, I can add it.
We are. We're on.
Uh,
Yeah. Like our names?
Yeah.
Yeah, we're there.
Including Wanda.
Right there.
Okay.
All right, I pulled it up. So
Thank you.
I'd move to adjourn.
yeah. Well, I was looking at our term end dates and I was like, that's interesting. I'll follow up on that later. No other committee business. Okay.
I'd move to adjourn.
I'm moved to adjourn.
I second.
Thank you. Oh.
I didn't have enough coffee today and I woke up at 4 and I went to bed. I think I'm